Before we jump into this episode, I want to remind you that while Caitlin and Sophia are dietitians, we're not your dietitians. This means the information shared in the Food Freedom Fertility podcast is intended to entertain, educate, and inform. It is not a substitute for medical care. This information is not intended to diagnose, manage, or treat disease. Always consult with your doctor before making any changes. Okay, welcome to another episode of Food, Freedom, and Fertility. We are your hosts. I am Sophia Pavia, registered dietitian, nutritionist, specializing in women's fertility, especially in like luteal phase, progesterone production, 2-week wait, implantation. That's my big bag of beans. And I have here my best friend and fellow dietitian, Caitlin Johnson. She specializes in PCOS and getting a high quality ovulation going every cycle. And we are joined here today by a very special guest. She has asked us to call her Victoria, and so we will. But you should know, she's not just a random Victoria off the street. This girl has got some credit. So, Caitlin, can you share with us a bit about this illustrious guest we have with us today?
Yes. So starting off with really impressive universities that she graduated from, University of California, San Francisco Med School, like really high class, board certified in family medicine and integrative medicine. But the things that really stood out to me, Dr. Victoria, Dr. Mays, is that how you say it? Mays or Mazes?
Maizes.
Mazes. Is that she's really a pioneering integrative medicine provider and educator. So one of the foremost integrative medicine training programs for particularly like medical doctors is at the University of Arizona. She was one of the ones that helped create this program, and it has now licensed 150 different medical residencies together, and her teammates at the Andrew Weil Center. She is also a founding board member of the American Board of Integrative Medicine. So you really have a powerhouse here of somebody that understands Western medicine, kind of the conventional medical model in America, and somebody that really gets integrative medicine and has been in it for decades, right, Victoria? So we're so excited to have you here. And I would
Very
love,
honored.
yeah, I'd love for you to like fill in a little bit of the gaps of what drew you with this like very conventional medical education into integrative medicine and how that's kind of shaped you wanting to help educate and draw others along in kind of managing both sides of the coin because they're both so necessary.
Well, thank you. Yeah, thank you so much for having me on your podcast. It's an honor to be here. I have always been interested in helping people live healthier lives. And when you go through medical school and residency training, a lot of the focus is how to treat disease, and not very much is actually on how to help people be healthy. I think that's where integrative medicine excels. It excels in prevention, but it also excels in helping people recover or restore their health when something goes awry. And that is what makes me happier than anything. When you can actually take someone who, maybe has one or two chronic diseases or thinks it's always going to be this way and help them return to robust health.
Yeah, you said that so well and so succinctly. So you have also a background in writing books. There's one that I think you must be on the heels of promoting right now, but also one that may be a little bit more in the pocket of our audience that's largely trying to conceive and have healthy pregnancies. So do you mind kind of sharing those accomplishments in case somebody is sitting here ready to Google at the moment?
Absolutely. So the new book is Heal Faster, and it's really all the things we can do to get well more quickly, to restore health, if you have to have a surgery, to both prepare for it and recover from it well, with all the things we have learned in integrative medicine, things that are physical, what you might do with physical therapy or with exercise or with nutrition, things that are emotional. How do you manage the mind-body connection? Things that are spiritual. How does our spiritual life fit in to whatever is happening that has brought us to this podcast, to a doctor? So that's the new book. The book that perhaps will also speak to your audience is called Be Fruitful, The Essential Guide to Maximizing Fertility and Giving Birth to a Healthy Child. And that very same interest in integrative medicine, which is how do you prevent disease? How do you help women and men, but Be Fruitful is more focused on women, get to a place where they are as healthy as possible, because that will both make it easier to conceive a child and also up the odds that the child will be healthy once it's born, which of course is what we all want.
Mm-hmm. That's amazing. Well, today we are going to kind of focus on this preconception period where you may actively be trying to conceive, yet you may be still managing the ups and downs of a monthly menstrual cycle. When we were
Yes.
kind of brainstorming about what we could cover today, one thing that's just kind of important, and I think you're going to hear this in what we chat about today, audience, is that what supports a healthy menstrual cycle is also just what supports healthy fertility. I don't know that you're going to hear something here today that you're like, never heard that before, but doesn't mean it's not helpful to listen to and maybe hone in on. But we want to kind of focus in on this period of time as we're about to get our period or in the midst of actively bleeding, in managing what people call PMS, which can look like a lot of different things. So PMS and hormonal health at large. And then if we have time for it, kind of dig into just the health of your vagina and different things you can do to support health within the microbiome and different conditions that can come up that may be relevant to us here. So where do we want to start, guys? Ladies?
Well, I think it's awesome. And I'm just going to say, in integrative medicine, in my clinical practice and the way I teach, we always talk about mind, body, and spirit. And so I think it's really good to cover all of that. From the mind perspective, we could talk about the role of stress and how that affects us. Certainly with PMS, there can be a lot of emotional, psychological symptoms that we want to address. From the physical or the body perspective, we think about your diet, your movement. There may be dietary supplements. Something that I think is incredibly important but very rarely talked about are the environmental chemicals that we get exposed to that can affect our hormones, and what we can do to mitigate those exposures so that we have fewer of these chemicals which can disrupt hormones, but also are not a good idea when you're trying to conceive. You don't want to have environmental chemicals in your body, which are then going to affect a developing fetus. So what can we do, since we live in a world that has a lot of environmental chemicals? And then, from the spiritual perspective, there are many things that we can use that also help, I think, ease suffering, that we turn to during times of difficulty, places that we get our strength. And so I'd say let's do it all.
Yeah.
Yeah, I
Okay.
mean, I think our audience is so they have heard us say environmental chemicals,
Yeah.
stress, like they've heard these messages
Uh-huh.
before. I think what would be so poignant and interesting to them is what to do about it. So like
Yes.
what as this expert doctor, what should you do? You live in a world that's inherently toxic. If people, driving a bus down the street,
Mm-hmm.
there's carpet
Carpets
in
in
your
our
house,
home.
paint on your walls. Exactly. And then with stresses, like it's not possible to live a stress-free life. Many
Right.
of us are in the sandwich generation where we're either trying to get pregnant or have very small children. And then we have elderly parents who also need a
Mm-hmm.
lot from us.
Mm-hmm.
What's a gal to do? That's really
Yes.
what I think people want to hear
And
about.
then your periods come in and
Yeah. Or maybe you hope it doesn't, but then it comes. What could it be
Yeah.
telling you? Like, instead of just looking at this, here comes my period, sad time, can we look at it with a scientific eye and reflect on this past cycle and look at perhaps the symptoms we're having during that period as a mirror to what our body's asking for this next cycle?
Yeah. I have been teaching about what can we do to nourish our health by reducing exposures to environmental chemicals for many years. And I sometimes say that I really couldn't have done this if it was only gloom and doom. If it was only, well, the chemicals are everywhere and we're all exposed and there's nothing we can do. Well, that's, not something you want to stand up and say. And so the bad news is, yes, there are chemicals that we're exposed to in a variety of ways in air, as you mentioned, air pollution, in cleaning products. We have a lot of choices there, in personal care products, in our food. In all of those domains, there are things we could do. Now, I would really love it if we had a society that regulated more and we were exposed to less. But I have to say, in this moment, when men and women are trying to conceive, it's the most important moment of all to reduce your exposures to these environmental toxins. So what can you do? You said you're behind a bus. Well, don't stand behind the bus. I mean, that's like, a duh. But also, can we get
But
the
it's like,
buses to
okay, I'm
stop
supposed to be
idling?
walking in the sunshine,
Right,
and then like here comes the bus, like every
right,
time, or like, I live
right,
near a freeway, there's roads
right,
around me.
right. So you really don't want to inhale those fumes from behind the bus. So you could pull out a mask like we learned to do during COVID and put it on when the bus goes by. You don't have to wear it all the time, but that's one thing. You can see if there is a green space to walk in. There are some apps that show you proximity to green spaces. And
that's cool.
most urban places, not all, will have some green space someplace. I was just in New York and I walked on the High Line. I mean, there are places often one can find with an effort, of course, and definitely not accessible to everyone. But if it's accessible, go there. Time in nature is really good for reducing those exposures, but it's also good for our souls. It's good for our stress levels. Walking in nature has been studied and shown to be much more effective at reducing stress than walking in a busy shopping center. So get to those places if you at all can. Other things you could do, you're driving in traffic, turn that recirculate button on so that you're not allowing the fumes to come in your home. In your home, get a HEPA filter. That greatly reduces the amount of exposures. You can get a HEPA filter kind of vacuum because often it's in the household dust where a lot of these chemicals live. So those are just a few of the things you could do for the pollutants that come from the air.
And vacuum more often.
Correct.
I gotta say, since I got a robot vac, I feel like the air quality in my home is 1,000 times better because we're just clearing it more often in the places that we live.
I'm with you.
Yeah. So I think we had somebody on a long time ago, and honestly, the interview wasn't very great. But that one tidbit, I was like, you're right. We need to vacuum more often.
Yes. And I mean, I know this is for trying to conceive, but if we think about who's at the floor level, well, it's our babies crawling around and then picking up the ball from the corner that's now coated with dust and putting it right in their mouth. So babies have a lot more, young children who have that putting stuff in their mouth behavior are going to be much more at risk. And our cats and dogs who are at that floor level, they also have an increased risk. So more often vacuuming, and I also have one of those robotic vacuums. My dog hair, way less dog hair since I started using that.
Don't let Louie listen to this episode, Soph.
They don't like them. The dogs don't like the robotic vacuums.
Dust. Oh my gosh, no. And the robotic vacuum, he kicked that out of our house as well because it's so stupid.
Yeah.
It's so stupid. It's like, I'm on a ledge. And you're like, no, you're not. You're sitting in the middle of the floor.
Oh, you just need a different one. Ours,
there's
we've had two and they're great.
I'm going to go bump into this door for the next 45 minutes and avoid this mess
We got a
entirely and
great
just keep
one.
bonking in this corner.
We got a great one, the Amazon brand, a Eufy, that was like just over $100 on Black Friday, but was, more than that normally. And it is awesome. I highly recommend.
Oh, maybe
Yeah.
we should get one of those.
Okay,
Well,
so
we can revisit it. It's been many years since we had the robot vacuum, but our robot vacuum got fired.
Got it. But I want to say a few other things. Most of us don't necessarily pay attention to the exposures through our skin. So the average woman uses 12 products on her skin every day. Think shampoo, conditioner, maybe you have a hair gel, maybe you have a mousse, perhaps you wear a fragrance, foundation, sunscreen, makeup, body lotion. I mean, we could keep going on. We use a lot of things. And I'm not suggesting people give
or
them
internally
all up.
Lubricant.
Correct. Lubricants, absolutely. And moisturizers
Mouthwash,
and
toothwash.
those mouth, exactly. But the ones we put inside the vagina, which that mucosal tissue really allows things to be absorbed. You want to choose wisely, but the same thing for your skin at large, for your head at large. And as I said, if I was speaking with you 10, 15 years ago, people would have to concoct things in their kitchen. Now there's this enormous green marketplace, and there are apps that allow you to scan the barcodes and choose wisely. So I recommend to all of my patients that they download the Healthy Living app. It's a free app from the Environmental Working Group. It has tens of thousands of products, so it's not everything, but it gets you a really long way at choosing things. And these days with reviews, you don't end up with a shampoo that doesn't sud or doesn't feel like it gives you clean hair. You really can get high quality products. The price is not very different. The same thing for the stuff that you're going to clean your house with. Now, clear vinegar is always a good choice, but there are lots of products out there that are much, much safer in terms of being reproductive toxicants. We don't want those. Carcinogens, we don't want those, or allergens. And that's what the Healthy Living app will review for.
So talk to me about this a little bit, Victoria, because we have talked about endocrine disrupting chemicals and toxic exposure. And we have talked about, like, how do you start? How do you make this affordable? How do you do all these things? But level with me and the audience on actually how important this is. Like, why should we really care? Because then we start moving into, we haven't even talked about your kitchen, and everybody's heard
Right.
get the plastic out, but
Right.
but we're not necessarily talking so much about the plastic in your Starbucks cup, and we're not talking so much
Right.
about, everybody's like, well, it's BPA free, but that doesn't necessarily mean it's safe.
Right.
But talk to me about, like, how important is this?
Yeah, I think it's incredibly important. I think it's tricky because it's kind of invisible, and it's kind of in the things we habitually do, like, getting a cup of Starbucks coffee, or, just sticking something in the microwave in a to-go container that has an unhealthy lining that then is absorbed by your food. So we, as an example, this was some years ago, but there was a study that looked at the umbilical blood of newborns. So before the baby had even taken its first breath. And they found the average baby had 200 environmental chemicals in them at the time of birth. That cannot be a good thing. And we know we're seeing increased risk of a variety of health conditions. Autism has become more common. Now, we are diagnosing autism in milder forms, but everybody agrees it's actually become more common. It's not just that we're making diagnoses around milder forms.
Yeah, because even the severe forms are far more common. Like, even if we weren't doing that, if we were just looking at people who are unable to live a meaningful life in society because of the autism, that number has definitely risen.
Right. And we also know it's not just neurodevelopmental diseases of childhood. It's also these exposures put you at risk for heart disease in later life. They put you at risk for Parkinson's in yet later life. And so I think they're incredibly important. And your question, Caitlin, about, well, what can we do about it, is a great question. And I think the answer is we start where we start. So for someone for whom this is brand new and they've really never heard this and never thought about it, you might just start by getting glass Tupperware and throwing out your plastic, or saving your plastic to store poker chips or something you're not going to be eating. For someone who's already done a lot of work on it, is there another step that you want to take? And so it really varies. It sounds overwhelming. And I always say to my patients, the perfect is the enemy of the good. You start where you are, you make some changes.
So true.
I don't believe that we ever were completely free of any exposures. I mean, if you think about it,
we have livers,
Fire.
we have kidneys, we
Right.
have.
We sat
when
around
people just
fires
have
for thousands
fires
of
in
years.
their houses.
Yeah.
Right. Correct. So we've always been exposed to some of these toxins. Heavy metals are in the soil, but I think we can overwhelm the liver, the kidneys, the bowels from doing the job that they do of detoxification if we get exposed, let's say, to too much. And also, I think when you're trying to conceive, this is when you want to be extra careful, because these things do move across the placenta into the baby. The placenta is not a barrier for environmental chemicals. And we take so much care during pregnancy about so many things. This is really a great thing to be paying attention to. So, as you said, you can reduce the plastic. I mean, when you go to Starbucks, you could say, "Can you fill up here's my stainless steel coffee mug." You don't have to put it.
Or do they tell you we can't?
They stopped during COVID, but they'll do it again now.
Okay.
Yeah. Yes.
You could bring your own to go. Like if you know you're always taking food home from that restaurant because they give you 2 serving sizes, you could just in a little bag bring your own Tupperware. You don't have to use. Exactly. And then things that you do every day. That's what I really encourage people to focus on. The shampoo you use to wash your hair every day or every other day, whatever it may be, that's where you get a green product that doesn't have these endocrine disrupting chemicals. If you're traveling and you're in a hotel, fine, use that shampoo. But the stuff you do every single day, the moisturizer, I live in Tucson, it's very dry. So the moisturizer you put on your body every single day, have that be clean. And that's where it can make a big difference. If you have a young child, picking the best milk that doesn't have bovine growth hormone in it, because you're giving that child milk and it's a big part of their diet potentially every day. So think about the daily things that could be improved upon.
Hey, Food Freedom Fertility listeners, we're taking a break from this episode to talk about our sponsor, Tempdrop. One of the reasons why Sophia and I love this brand so much is that it's an all-in-one solution and it's so easy to use. You wear this Tempdrop sensor on your upper arm during your sleep, and then in the morning when it's convenient for you, you sync it to their charting app. If you've been tracking your fertile signs for a while now, you'll know that this means freedom. And isn't this the Food Freedom Fertility Podcast? In order to accurately track your basal body temperature, you need to wake up at the same time every morning. But what if you're a shift worker or your schedule differs and sometimes you sleep in and sometimes you don't? That's one of the reasons why I love this tech so much. Tempdrop uses the latest scientific knowledge to bring you an accurate method of cycle tracking and identifying your fertile window. Tempdrop's sensor continuously monitors your basal body temperature while you're sleeping. And then in the morning, you open the app on your phone and you sync the data. And what that means is that it's not transmitting information from this sensor next to your arm to your phone all night long. And I don't know about you, that gives me a lot of peace of mind that I'm not exposing myself to radiation all the hours that I'm sleeping. Because this tech makes tracking your temperature so much more accessible and really takes a lot of the brain power out of it. You don't even need to charge it every day. This is one of the reasons why I personally use Tempdrop to track my own basal body temperature. Make sure when you go to tempdrop.com that you use our discount code exclusive to our Food Freedom Fertility listeners. That code is FFF15, Or you can head to the link in our show notes of all these episodes. Click on that link and you'll get 15% off today. We are taking a break from the episode and I want to chat with you a little bit about Fertility Cloud. If you've been told you need help ovulating or you have PCOS and you're trying to figure out your next fertility step, I want to tell you about Fertility Cloud. They make fertility care simple, transparent, and affordable, especially when it comes to ovulation stimulation and ovulation induction treatments. Instead of waiting for months to see a fertility specialist or getting hit with surprise bills, Fertility Cloud lists every price clearly right on their website. You'll see exactly what you're getting into and exactly what it costs. No hidden clinic fees, no surprise invoices later. For my PCOS clients, this is huge. Their ovulation stimulation program can help jumpstart ovulation safely at home with physician guidance and medications delivered directly to you. You can do it all virtually, no driving to clinics or sitting in waiting rooms, and you can often even get appointments same day. If you're wondering, how do we do ultrasounds or what about lab draws? Don't worry, their concierge service helps determine where you can do that locally to you and coordinates with you on your behalf. It's just amazing. And here's the best part. If you're ready to take that next step, you can click the link in our show notes and get $50 off your first appointment. That means you get right in front of a fertility specialist for $115. That first visits gets you matched with a fertility doctor who actually understands your needs, and you'll walk away with a clear plan for your next cycle. So head to the link in our show notes, book your appointment, save $50 on your first Fertility Cloud visit, because fertility care should be transparent, affordable, and built for you. All right. I think this is helpful. I think let's move on to let's talk about normal physiological change that happens as you're going towards the end of your luteal phase and your period's coming. What would PMS look like in somebody that it's normal and routine and unconcerning versus what could PMS look like if it seems out of the range of normal? And I don't mean normal to society or what's common, but what would be like physiologically normal of a healthy body?
Yeah, so I think that's going to vary a little individual by individual. Um, I mean, 80% of women have some degree of PMS symptoms. So it could be a little cramping, a little swelling, a little bloating, a little moodiness, but something that someone goes, oh yeah, my period's coming. And it doesn't concern them. And when it becomes something you want to talk to a healthcare provider about is when it bumps up to interfering with your normal, happy, healthy life. And that's going to vary from one woman to another. You know, one woman may have some kind of intense cramping and she pulls out a heating pad and puts it over her low belly and pelvis and she feels fine. Or she takes an occasional Advil and she feels fine. And another woman's going to say, that's not acceptable. You know, why am I having this? And will want to resolve it. So I do think in integrative medicine, we very much individualize our care, and what is sort of normal for one may not be acceptable or normal for another.
At what point, though, do you see this as becoming like a pathology? Like, where should somebody start to draw the line for themselves? When is it not just about, personal comfort and your ability to enjoy life with a heating pad on? When does it
Yeah.
become something that somebody should start looking into from a medical perspective?
Yeah. Well, even if it's mild, but if you think about the number of menstrual periods a woman's going to have in her life, 12 or more a year times 40 years. I mean, even minor symptoms might be a reasonable thing to bring to a healthcare provider to say, is there something I haven't paid attention to that I might want to do differently? Obviously, if the symptoms are severe, you can't go to work because you're having such intense cramping or pain. Your emotional symptoms are such that they're really interfering with your life. Your relationship with your partner is really affected. I mean, those are all warning signs that, yeah, this is something you want to pay attention to.
What about, let's bat some things to
Mhm.
Dr. Victoria and see what she bats back, Sophia. So like,
Okay.
what about bleeding 3 days before your period actually starts? Physiologically normal or something to be concerned about?
Yeah, like spotting.
Well, I'd want to understand why. As a physician, I would want to do some evaluating to understand what's happening that is leading to that kind of change. So I think that's a very reasonable thing to go and get checked out, so to speak. Sometimes there's really simple things that we can recommend that kind of normalize that kind of symptom. Sometimes it's a sign of thyroid disease, and the path that you go on is completely different.
Okay. Well, what's really coming through my mind? I mean, honestly, listener, I'm sure you're thinking this exact same thing. You're like, bring it to a doctor. That's a laugh. Like they could care less. Do you want birth control pills or do you want narcotics? What would you like for me to give you today for your period pain? We can keep you from having a period altogether and give you this IUD. We can make a small withdrawal bleed period and give you these pills, or we can numb the pain entirely and I can write you a stronger pain prescription. This is usually, if any
Or you
tool
need
at
an
all is offered.
antidepressant.
Yeah, you
It's a
need an
mental.
antidepressant because you're mental. Because I'm a doctor who's a woman and I've had my period every single time and I've been doing surgeries on people while bleeding down my legs and I never complained. So shut your hole. I hate you. That's usually how you feel when you leave a doctor's appointment where
I'm so
you bring
sorry
up
to hear
period
that.
pain.
That's just horrible. I would say find another doctor. I don't think that is true of all doctors. I'm not saying that you didn't have that experience or some of your listeners didn't have that experience. Go find an integrative medicine doctor. One of the things we pride ourselves on is listening to our patients. There are so many things that can be done that are not pills, birth control pills, opioids for pain. There are just, SSRIs. There are many other things. So the first thing that I often recommend to women is that they explore whether they may have a micronutrient deficiency. And there are 3 different micronutrients that I think about: calcium, magnesium, and vitamin B6, which is, of course, vitamin. The calcium, magnesium, and vitamin B6 collectively, synergistically, often dramatically reduce symptoms. And so I usually have that as a first step for women to see whether they reduce their symptoms, both physical and emotional kind of symptoms. And I ask them to give it 3 cycles. Calcium, usually dosed 500 milligrams. We don't like to do more than 500 milligrams at a time because you don't absorb it. You may not need any more than that because women get calcium in their diet. They get calcium from their dairy consumption. That's the most commonplace, but almonds, figs. I mean, there's a lot of foods that have some calcium in it. Sardines, if you consume the little bones. So calcium is one. Vitamin B6 is really interesting in that it affects the ways in which the neurotransmitters in our brains work. So it really helps with the emotional, psychological, by making the production of our serotonin, our norepinephrine, our dopamine more effective. And so a vitamin B50 complex, there are 8 different B vitamins. They're usually, not always, but they're usually 50 milligrams or 50 micrograms. That's why it's called a B50. So adding that, and then magnesium can help relieve cramping. It often helps people sleep better. When you sleep better, often your mood is better. So magnesium may not work quite as directly as the calcium and B6, but it's also a very effective strategy. And so I really like for people to begin there. As an integrative medicine doctor, I'm always inquiring about people's diet. Some of the PMS symptoms are inflammation, and we can alter our diet and alter our microbiome, which makes these neurotransmitters, which contributes to inflammation by altering our diet.
Absolutely. I think those are really great recommendations. When you think about PMS, and that kind of covers maybe some of the cramping sensations with having a good amount of magnesium, the psychosomatic stuff, like what's going on in the brain and the body at the same time. When you think about inflammation or gut health, is there any correlative things you want to bring up? I often think about gut health, especially when people talk about period poops, right? So the
Mm-hmm.
idea of having that extra histamine around close to your colon around the time of um, menstruation, just
Menstruation.
to help bring about the movement and cramping and blood flow, like the actual geography kind of change that's going on. But it can impact the transit time and stooling experience for a lot of patients. Is there anything that you think about kind of specifically in this phase of
Yeah.
someone's cycle?
So there are a lot of ways to support the health of your microbiome. Some are the don'ts and some are the do's. So in terms of some of the things we advise that people do is we really like people to eat fermented foods. Pick your favorite. That can be yogurt, kefir, kombucha, sauerkraut, fermented pickles. Not all pickles are fermented. The ones in the refrigerator section of the store are the ones that are going to be fermented food. Kimchi,
Sometimes not. You got to look
correct.
at the jar.
Yeah. Yes, agreed. And you can learn to make some of these yourself, which is very fun. I make my own kombucha, and that's kind of a fun thing to do. Not terribly hard. It sounds hard, but it's not terribly hard. So fermented foods, they are going to introduce more of these healthy bacteria into your system, which are good for the gut microbiome, also good for the vaginal microbiome. We don't talk that much about the vaginal microbiome, but it's different than the gut microbiome. And by the way, we have microbiomes everywhere. We have it on our skin. We have it on
Mm-hmm.
our
Your eyes, your nose, your
yeah,
teeth,
everywhere.
everything. Yeah.
And it's different in those different places. So fermented foods is one. Another is increasing your fiber. Fiber is food for the bacteria and other organisms in the microbiome. And so a lot of us don't get enough fiber. We know that most Americans don't get enough fiber. So where does your fiber come from? Mostly vegetables and fruits. Some have more, some have less. But you could also do flaxseed. You could add some flaxseed to your yogurt, to oatmeal, to a smoothie. It can kind of be tucked into all kinds of places. People sometimes use psyllium husk, metamucil, citrusel. These also can be sources of additional fiber. So you want fiber because of what Caitlin just said, that transit time, having things move through more quickly. The fiber also helps the reabsorption and excretion of estrogen. So it helps keep your estrogen levels more normal if you have a diet that's rich in fiber. There are some funny things. Having a pet, we were talking earlier about dogs. Having a dog actually gives you a more diverse microbiome. Having a garden, eating organic foods. There are just many, many things. Reducing your ultra-processed foods. Ultra-processed foods are bad for you for a lot of reasons, but one of them is the way it affects the microbiome. Avoiding artificial sweeteners, which do a hit on the microbiome. Avoiding antibiotics. Now, obviously, if you're super sick and you need an antibiotic, you should take the antibiotic. But sometimes we go in and we have a cold and we're like, I know it's going to become bronchitis. Please give me an antibiotic. That's what you want to avoid. You really want to minimize, because it can take months for your microbiome to come back after taking an antibiotic. And some women who are susceptible, taking an antibiotic will lead to a yeast infection. Then you're treating that, and that
Or
alters your
beyond.
vaginal.
Truly,
Yes.
in my experience, I ended up with endometritis
Mm.
I truly believe, which is the infection and inflammation of the uterine lining itself, I truly believe it was from this year that I had working in public health where I got strep throat again and again and again and
Uh-huh.
again and
Uh-huh.
again, and
Yeah.
ended up having to go, it was seemed like every 6 to 10 weeks I was getting another
Mhm.
pack of antibiotics, another pack of it,
Hmm.
sometimes even more
Yeah.
quickly than that. And
Right.
the long-term microbiome. I mean, what are you going to do? Get rheumatic fever and die? Like when you have strep
Right.
throat,
I agree.
you
If
have
you have strep
limited
throat, you
options,
take the
but
antibiotic. Hmm.
amen. But it
Yeah.
just
Yeah.
kept happening because I was in a bad situation in many ways. But I just want to emphasize, listener, that if this resonates with you, it can be that, maybe you didn't think much of the fact that you got all of those ear infections in a row when you were in college, or bronchitis so
Hmm.
many times, or
Hmm.
whatever it was. We had to continually go on the antibiotics. But it can be actually really impacting you now. And
Hmm.
unfortunately for me, revenge is a dish best served cold. And to resolve my endometritis, I had to go on another antibiotic, but it worked. And I was able to have a baby and everything like that. But I just really want this to like stick in your mind, because many of us have in the past had situations where these things unfolded. And some of us have chronic conditions like asthma, where every time, just like Dr. Victoria just said, every time you're sick, your doctor's like, I know this is going to be bronchitis. I know this is going to turn into whatever. We're just going to put you on the antibiotic as soon as you start coughing, because I just know that that's where this is headed for you, because your lungs have a weakness and can't clear properly.
Yeah. So I agree that if you have to take the antibiotic, you have to take it. And
Mhm.
one of the points I make in Heal Faster, in fact, the subtitle of Heal Faster is Unlock Your Body's Rapid Recovery Reflex. And
Yeah.
we do have the ability to come back from that. You just described that you came back from it. It took time, but you were able to come back and restore good health and
Yeah.
have a
And it took a
child.
lot
And
of
so,
changes, probably what you are outlining in your book. Like, I needed to cut out, I mean, I'm mold sensitive. I found that out. And so there was like high mold foods I had to quit eating, one of which being
mhm,
coffee, which was so sad for me,
mhm,
but like switched over to matcha, and got a good air filter, and did some
mhm,
allergy testing, and found out that like dust mites were also a big issue for me. And
mhm,
so then changing a lot of the environment in my home, and like
mhm.
there was a lot of things that went into me being able to go without antibiotics for months at a time, when it after a long time, when it was like constant sinus infections. I even had a sinus
Mhm.
surgery. Like there was a lot going on for me there. So it certainly wasn't something that just like happened because I, drank a carrot juice or something that people might
Right.
think there's
And
like a quick
it
fix to
can
these
be a
things.
journey. And, I really appreciate you sharing that story because sometimes it's simple, sometimes it's complex, but you just gave yourself as a personal history where there were many things you had to do to restore your health from uh, taking an antibiotic for the endometritis to reducing foods, including some foods that you enjoy, to having
Mhm.
sinus surgery. I mean, it was a journey, and you found your way. And I think too often people have this sense of I'm doomed and there's nothing I can do, as opposed to it may be one thing that's simple, it may be 10 things that are much more complex, but can you find your particular path towards restoring your health, and um, to not take in the cultural message of, well, once you've got it, that's it. Now you're going to be
Mhm.
sick from here on in, and or now you're not going to be able to have a baby, or now you're not going to be able to, fill in the blank depending on what's happening. And so I want to really convey that hopeful message of there is often a route to restore health, and it may not be simple.
Yeah, it's often not simple. And it's taken decades or many years to get to where you are. And just because we're used to modern medicine curing things or treating things with medicine and surgery, which are pretty quick solutions typically, the natural solution of supporting your body to heal often takes time along with effort. And if you're not willing to put in the time and the effort, it's going to be hard to expect a natural solution to be the solution that supports you. We're going to take a break from this episode to hear about one of our sponsors. You've probably heard me say this before, but preparing your body for pregnancy is not just about you. It's about both of you. Fertility is truly a team effort, and that's why I love the Fullwell Fertility Trio for Two. Fullwell was founded by a fellow registered dietitian and fertility expert, Ayla Barmer, and this bundle was designed to support both partners in the months leading up to conception. It combines their top-rated prenatal vitamin, omega-3 fish oil, and a fertility booster supplement that covers things like CoQ10, N-acetylcysteine, alpha-lipoic acid, and organic ashwagandha root extract. The nutrients here support overall egg quality, sperm health, fertility, and even your stress resilience. If your partner's semen analysis looks normal, or if it's suboptimal and we need to improve things, nutrition plays a key role for things like sperm motility, count, and DNA quality. For women, these same nutrients help with ovulation, egg development, and healthy hormone balance, not to mention mitochondrial support, which is a huge piece of how your gametes mature and get ready to be that queen egg or that king sperm that make it to combining to form an embryo. These things are foundational for a strong, healthy pregnancy. I personally love that Fullwell's formulas are third-party tested, they're evidence-based, and made with doses that actually match what the research shows we need. No fluff, no underdosing. So if you're planning to start trying this winter or sometime in 2026, or you've been trying to conceive for a while, it's time to think about starting to nourish your bodies for what's ahead, or take a step up from your current protocol to one that is high quality. Head to fullwellfertility.com and use the code FFF20 for 20% off your order. That's FFF20 at checkout. I'll drop the link in the show notes for this specific fertility trio bundle and for Fullwell, along with this code FFF20. Give yourself and your future family the best foundation with Fullwell's Fertility Trio for Two.
I agree that often these strategies, dietary change, supplements, mind-body strategies, we haven't talked about that yet, they take longer to work. They are not a quick fix like a surgery or a pill, and they are supporting your innate healing system. So from a long-term perspective, I think that those are the way we want to go. Sometimes you don't have a choice. Sometimes you have to have the surgery to correct the problem. Surgery can be miraculous. I am not anti-surgery. Sometimes taking a medication is the right thing to do if you're having severe symptoms of one kind or another. And the medicine is the way to mitigate those severe symptoms. And then you can, if you're listening to this show, more gradually restore your health so that you could then eventually get off of the medicine and not need it.
Guys, I don't know that you're listening maybe on the podcast sources and not hanging out with us on YouTube, which you should check out. But I'm not sure Dr. Victoria has stopped smiling this entire episode. There's something that's just like incredibly...
She is very smiley and very beautiful about
you.
her.
A
very
soul.
a very
I mean, you're a beautiful woman, but there's just
yeah.
something, you know, when you're with someone, you're just like, this person lives it. This person exudes something. Dr. Victoria smiles while she talks, and there's something really comforting and lovely about it. I just want to share that if you're only listening over. Maybe you can hear it. I think sometimes you can hear in people's voices what's going on their face, but I just had to comment on that.
Thank you.
Victoria.
That's so kind. Thank you.
I want to make a comment too. I tried to say this a couple times. I just want you, listener, to really hear the message that Caitlin and Dr. Victoria just shared, that this is slow. And so if you are not pregnant yet, while you're, quote, doing all the right things, quote, keep in mind that healing is slow, and it doesn't mean you're doing the wrong things or you're doing too much or that these things don't work or that it's all for nothing. These thoughts are very pervasive and very discouraging. A lot of times when we're talking about years of metabolic damage, like let's say you had PCOS all this time and you only knew about it once you started trying to conceive, it's going to take time for your body metabolically, hormonally, physiologically to heal. And same thing with many people that I work with that are sort of overtrained, overstressed, underslept, high performing, like coming away from that. Yeah, there are stories like a couple episodes back where Caitlin had a gal that switched on to 3,500 calories, got started ovulating again, and was pregnant within 6 weeks. That does happen, but that's not the only thing that happens. And healing can be slow. And so I don't want you to feel frustrated by that slowness. I want you to feel encouraged that it does mean you are on the right path and you are doing the right things. It's just you need to heal.
I think
You need time to
sometimes
heal.
when you're in the midst of pain, you want out of the pain right away.
Of course.
I mean, is that not just like
Of
biological
course.
within us?
Oh,
Like,
who doesn't?
oh, there's pain. Right.
Always
And
Yes.
find any
the
way
thing
out of
about
this.
trying
Yeah.
to conceive
Yeah.
pain is it's recurring. You know, the topic of the episode, PMS, means a menstrual cycle return. So you've got that psychological component to it. But you also may actually be physically in pain, which is a frustrating layer, right? Like you actually may have cramps, or I can always tell that I'm about to get my period because I may have a slight headache,
Migraines.
or I think I'm getting sick for a day, and then I'm like, oh, I'm bleeding. It's like, oh, okay, well, maybe that achy something. It was just like the shift in the hormones, and now my period's here. Or all of a sudden, everyone in the world somehow is so annoying. Why did my best friend, who I could handle perfectly yesterday, now I just want to like be like, let's talk in 2 days, you know, whatever, right? Like,
Hey.
but I was actually thinking about
What are you
my
trying to
best friend
say to
as
me,
my husband,
Caitlin?
but you know, it's like come back in a couple days once I deal with this major drop in hormones. But that's real, and it happens a lot. And so people look for relief from pain. What can I do next? I think Sophia and I have talked about this almost like revenge eating that happens sometimes, where you know, you're distraught, your period came, you're not pregnant. Yeah.
I call it rebellion eating, more like you're rebelling against all these things that you've been doing, quote unquote, right. And now your period's here. And you also, I personally think there's a hint of you feel very betrayed by your body.
Oh,
and you
that's so
sort of want to
sad.
punish her.
I mean, how about another frame? I'm just going to change the frame.
It is.
One of the reasons I think that when we are in that PMS time, we crave sweets is that carbohydrates, which is where a lot of the sweets
Quick energy.
are precursors to serotonin. So if you think about the name of our medicines for depression, SSRIs, they're selective serotonin reuptake inhibitors, which means that we have more serotonin hanging around in our brain. So when you eat those carbohydrates, you are able to produce more serotonin. And so your body is, in a sense, being wise. It's saying, this woman is struggling. This woman is feeling irritable. She's having a down day. Let's give her some more serotonin. And there's a better way to do that with complex carbohydrates, so that if you can, rather than, having 10 cookies, if you can have some carbohydrates that are slower to digest. So that's going to be whole grains. That's going to be vegetables. And you're still going to get that serotonin. It's not going to happen as fast as the cookie. It's going to be a little bit.
But you're
more
also not
slow.
going to fall like the cookie's going to make you fall, right? You're going to have that blood sugar
You're not going to crash. Yeah.
Yeah, it's not going to have a backlash come back to bite you like the cookie would. Yeah, and there's so much pleasure. I mean, Eating delicious foods is so
That's
pleasurable.
another form of self-nourishment. You're doing
Mhm.
something, you're having a hard day. And one of the ways we nourish ourselves is with food. It is one of the ways we take care of ourselves. So I don't know. I don't want to beat up on us.
My point in bringing it up is like people are searching for the solution,
Yeah.
right? So in an attempt to find a solution, I don't know how active you are in clinical practice right now,
I
but
am still active in clinical
Severia. Okay.
practice. Yeah.
So
Yeah.
I find people are coming in and they're like, I saw this like PMS pill that
Yeah.
has Dong Quai or however you
Yeah.
say it, and black
Right.
cohosh and Vitex and
Right.
this and that and red
Right.
raspberry leaf. And then somebody else
Right.
comes in and they're like, I'm taking SAMe because I
Right.
heard somebody say this could help me with my
Right.
mood around my period.
Right.
And so
Uh-huh.
for the people that are reaching because they're in
Yes.
pain, they're pain
Yes.
because they're not pregnant, and they're in
Right.
pain because their body is maybe really struggling with something. You brought up
Right.
calcium, magnesium, B6. Are
Yes.
there thoughts? And of course, I know the initial answer is this is very individualized and we got to look at the exact person, but
I'm going to give you some specifics. I
things to
want to
love,
just
things to
differentiate.
avoid. Yeah.
Yes, I want to differentiate between emotional pain, which is probably not going to be particularly helped from these herbal medicines, and physical pain, which is more likely to be helped. So one of my go-to remedies is curcumin. Curcumin is an anti-inflammatory. It's a spice. It's in our
Mm.
food, but it's usually in our food in relatively small amounts. And so you really do want to add this as a supplement. It is a wonderful natural anti-inflammatory. It has been studied for PMS and shown to reduce the pain associated with cramps. So that would be, if that's the kind of pain you're having, cramping pain, taking that anti-inflammatory. And I like for people to kind of take it regularly. There are things you could take just at the time of the pain, for example. Like if you want to take ibuprofen because it was really bad, you take it at the early point of having symptoms, but you wouldn't take it a week ahead of time. So you do want to take curcumin throughout the month. I really like people to be on it. It has some evidence as well of what I like to call this side benefits. We hear so much about risks and side effects and adverse effects. In integrative medicine, we often have what I like to call side benefits. So the side benefits of curcumin: less metabolic syndrome. That's wonderful. It can help if you have joint achiness, arthritis. It actually can have some effect on depressed mood. That's pretty fabulous. It lowers cholesterol. So it has a lot of side benefits. Even if you've had a hard workout, it'll reduce that post-workout muscle soreness. I like people to take it. It's not expensive. It's widely available. The dose kind of depends on the formulation that you get, because some of them are highly purified and they're using nanotechnology. So I'm a little hesitant to say a dose on air because it will very much depend on which brand you buy. But it does not have to be expensive and is widely available. One of the botanical medicines that we use sometimes for more of the emotional pain, the irritability, depression, would be saffron, another spice, interestingly enough. And that has been studied and shown to be effective for a variety of symptoms: fatigue. Caitlin, you mentioned a headache. It helps prevent headaches, bloating, irritability, depression. So that's pretty awesome. And there I will give a dose. It's usually 30 milligrams once a day. That's the dose that's been studied in studies. And then another one that I think is a classic PMS botanical is chasteberry. Chasteberry, the Latin name is Vitex. It has its name because it was thought to make people chaste. The monks used to grow it outside in their gardens to reduce their libido, to help them be better ascetics and avoid their sexual desires. But chasteberry does affect
We don't want
the
that around here while we're trying to
right.
get pregnant. So tell me it's not
Correct.
doing that to me.
No, I think it honestly can work the other way. Like I see it when people start using it, we see better libido, we see better
Correct.
it will lower
No, so
prolactin.
it
No,
turns
that
out
won't
that
really make
that
your libido
is
better,
not
will it?
true. It
No,
was a
but I just
folklore that the monks had it, and that's how it got its name. But in terms of scientific research, that's
gosh,
not
the
true.
amount of time we spent trying to suppress sexual
Like
appetites with
eating
various
Kellogg's.
things, like
Yeah,
the whole Kellogg's
yeah,
brand, that's like their whole thing, right?
yeah.
So many things like this. Really weird
Yes.
that we were so
Anyway,
obsessed with this.
How
just
about
to
you
make
just
sure people
have a
get
good
this.
sexual partner? Okay, I'm sorry.
Yeah.
Dr. Victoria.
But chasteberry or Vitex is really helpful at balancing hormones. It does increase prolactin. It does increase progesterone in the luteal. Thank you. Sorry. It decreases,
Decrease
correct,
prolactin,
prolactin. It increases
right? Yeah.
progesterone,
Okay.
which is helpful during the luteal phase in terms of helping women who are trying to conceive, who may have a slightly shorter luteal phase, and that's what's interfering with conception. It also appears to stimulate dopamine, which is, a reward neurotransmitter. So it's really probably the one that is most specific to PMS. You mentioned some other things, St. John's wort. St. John's wort is an awesome botanical if you're suffering from depressed mood. The thing you have to be careful about with St. John's wort is that it affects the metabolism, the liver metabolism of medications. So maybe you're not trying to conceive and you're on birth control pills, and your St. John's wort makes your birth control less effective, and suddenly you're pregnant. That's not going to make you happy. Maybe you're on an immunosuppressant because you have a certain kind of medical problem, and your St. John's wort makes it less effective. And so if you're on no medicines and you have some depression and you want to say, let me see if this helps, that's fine. But if you're on any medicines at all, this is a really important one to check out with your healthcare professional and make sure that it's not going to have what we call a drug herb interaction that you don't want to see happen.
Man, and who wants St. John's wort? No giggles. I don't want a wart from St. John. Just
I
it
don't
sounds
get what you're
gross.
talking about.
I know it's spelled differently.
Okay, but I want to say,
Yeah, that is a
now I got
really
the joke.
weird-
Sorry, it took me a minute because it's not spelled wart.
It's not spelled like it, but
Yeah.
come on.
Okay,
It sounds
yeah, like,
terrible.
what are you talking
But I
about?
want to tell you, it's this beautiful plant with these yellow
It does.
flowers, and the flowers have these little fenestrations or holes. And so this comes from what we call a similars property. The flowers actually let the light in. And that's what St. John's wort, from an energetic perspective, is thought to let the light in.
Let the
which
light
is
in.
exactly what we want when we
Oh.
have kind of a dark mood. We want to let the light in, and that's what it does. And doesn't make you warty. Yes, thank you,
I know.
Kulu.
Isn't it interesting in, well, I'm glad I said it, that it brought that out. Isn't it interesting in botanical herbal medicine that very often like the impact is so aligned with like the look or that's just so cool to me. But Vitex, I feel like this herb is incredibly widely used and you hear a lot of different things about it. Do you have thoughts on if people should use it? Like, for instance, you said with the curcumin, should they use it all the time? You hear practitioners say use Vitex only until you ovulate, or use Vitex only after you ovulate, or use Vitex all cycle long. Does that
Yeah.
depend on how you're treating someone, what you're treating them for, or do you have thoughts on that?
Yeah, I have done it both ways. I've done it only luteal phase, and I've done it all month long. There is research to support the use of Vitex in PMS, and in general, in the research, it's dosed every single day. So in the studies, that's how it's dosed. But a lot of herbalists just use it during the luteal phase. And this is, I think, where it's really lovely to work with someone who has experience with these herbal remedies. That could be an herbalist, it could be a registered dietitian, it could be a naturopathic doctor, an integrative medicine doctor, a women's health doctor who is more open to these things and not kind of just going it alone. It's sometimes really wonderful to have a partner who can help guide you with all of this. But there's a little bit of the art of medicine here, where there's not one single right way.
Okay, so we've talked body a lot. We've talked even mind, talking about dopamine and serotonin. We've talked some specific symptom pieces, but you started, and I think maybe it's worth tying a bow on this episode on more the spiritual side of PMS treatment as we're treating whole humans. Sophia and I are professed Christians and have a largely Christian audience. So I'm going to, we haven't talked about this prior to recording, but I just don't want to set you up to be completely tuned out in this moment.
Thank you.
Okay, and here comes this Buddhist monk she was just talking about. And honestly, we're not asking necessarily your beliefs, but you know, when we're talking about the whole person, you can't leave out this piece that has something to do with life force, that has something to do with faith, that has something to do with connecting with the earth and the elements that were in our view created and have purpose. But I'd love to give you an opportunity to kind of speak on this since you brought it up early on.
Yeah. In my first book, which is called Be Fruitful, I have a chapter on spirituality. And I think that this is one of the areas, not necessarily for the two of you, but that in general gets left out. Some people say that to create a new life, you need 3 entities, let's say. You need male, female, and God, right? I mean, you could do everything right and still not have a child. And so for some people, there is an enormous just challenge of faith. Like, why am I not conceiving a child? In the Bible, one of the Bible stories is about a woman who can't have a child, who prays, prays and is then able to conceive. I think that we need to inquire, and I take care of people of every religious background. I am not, a priest, a rabbi, and a mom. I mean, I'm not someone who has specific religious training, but I think that there are common principles. And one of the things I ask people is whether they have a religious practice, a faith tradition, a spiritual practice that's important to them. And they answer, sometimes the answer is yes, I'm a devout Christian. Sometimes the answer is I have nothing. I don't believe in God, or anything in between. And when it's the first, I say, is that an area that you want to put a little more effort into? Do you want to go and talk to your minister? Do you want to go to services? Do you want to use one of the prayers that actually is directed towards conception? Is there a ritual in your religious tradition for people who want to conceive? So I really encourage people to explore their faith and the way in which their faith serves them in trying to conceive. Then there are what I would call global things. So, for example, the expression of gratitude is global. It's part of every religious tradition. And so I talk to people about gratitude practice. I mean, this is something that costs no money, because you were saying, what about if someone's super stressed? They don't have time. They don't have this. Well, at the end of the day, as you're going to bed, sharing 3 things that happen that you feel grateful for. And they could be tiny. They don't have to be big things. I mean, it could be
big points if they're tiny, right? That means you're noticing the very
correct.
little things in your life that have impact
you're paying
and
attention.
meaning. Yeah.
Right. So it could be, that like the rose on the rose bush outside just bloomed, and you saw the first rose, and you stopped, to smell, and it's like, I have this new rose bush, so I'm thinking about that. It's a Barbara Streisand rose bush, and it smells awesome. I mean, I'm like, how do you get a
Oh
rose bush named after you? I don't
my.
know, but it could be something very small. Your sister called, and you had this lovely conversation with your sister, and you're grateful that you have this relationship where you get to chat with your sister. So it doesn't have to be, you got a promotion, you won the lottery, something huge. So that's one practice that I really encourage people to put in place. And there are other practices that are, I would say, not directed towards any one religion, but that acknowledge that this is a dimension of our humanity.
Oh, everything you said and more. Definitely a
Mm-hmm.
lot of gratitude, a lot of, I don't know,
Mm-hmm.
calling it sort of the division of responsibility.
Mm-hmm.
Like, what
Mm-hmm.
is your job and what is God's job? Are you supposed to be
Mm-hmm.
trying to do this, that, and the other thing? Or is your job
Mm-hmm.
to lay that at the foot of the cross
Mm-hmm.
and then let God move? That's one that's really hard for me. Caitlin and I are both in this Bible group
Uh-huh.
called CBS Community Bible Study, and around the
Uh-huh.
world, everybody uses the same study materials, and so we're all studying Psalms, and so much of it
Mm-hmm.
is wait on the
Mm-hmm.
Lord,
Yeah.
be still before the Lord,
Mm-hmm.
which is very challenging
Yeah.
when you expect action and
Yeah.
you would like progress, and you are
Mm-hmm.
in a painful place, and
Mm-hmm.
so you don't want to wait in pain.
Mm-hmm.
You want to take
Yeah.
action to move away from pain. But we talk a lot about that, about having,
Mm-hmm.
being in community with other
Mm-hmm.
people that will pray for you
Mm-hmm.
in ways where you are stuck, that will trust God alongside you in ways where
Mm-hmm.
you feel so full of doubt
Mm-hmm.
and fear and questioning, and really just being so real with the God who created you and knows all of your very being, that you don't have to try to clean it
Mm-hmm.
up. This is a
Mm-hmm.
big theme in the Psalms that we're studying. Is you read through it that it's a lot of like praise for the God who is and the God who is strong, but a lot of
Mm-hmm. Mm-hmm.
reality that I am suffering and I am sad and I am hurt and I am surrounded by enemies, and that I can't sleep and I can't eat, and they are encroaching on every side. I'm being blamed for things that aren't my fault, and all of this kind of stuff. Yet I stand
Mm-hmm.
before a God who is good. I
Mm-hmm.
stand before the Lord of all, who makes my very breath rise and fall within me. And um so we talk a lot about that, and how just because you're suffering doesn't mean that
Mm-hmm.
you're doing something bad spiritually.
You're not being
Doesn't mean you've
Mm-hmm.
taken
punished
some
Yeah.
sort of
or, yeah.
wayward turn.
Mm-hmm.
You're certainly not being punished. And yeah, infertility is not
Mm-hmm.
a disease for bad people. It's not God's way
Mm-hmm.
of punishing people for their sins. It's not because you let your boyfriend touch your boobs when you were 15. It's not because
Mm-hmm.
you, or beyond, more,
Mm-hmm.
even, darker and more
Mm-hmm.
sinister things that people may have been a part of at times in their lives. It's not a punishment for
Mm-hmm.
these things. I was just
Mm-hmm.
going to say that God is really
Mm-hmm.
on your side, that he loves babies. He's the God of life, the God of healing. And a controversial take that maybe not a lot of people like that we talk about is how you don't see Jesus ever giving someone
Mm-hmm.
infertility. Like, he didn't like walk up to someone and be like, here's what you
Mm-hmm.
need. He did tell people some hard things: sell all you
Mm-hmm.
own and follow me, or leave that man that you've been living with who isn't your husband, or like, he's real. He's not just like everybody
Mm-hmm.
just have a bake sale and smile at each other. But never walked up to anybody who came to him for help or healing and told them, you're going to need a few more years of infertility.
Yeah.
That's what's going to help you.
One
Never.
thing, I was literally on with a patient before this call, and I know that similarly, Dr. Victoria, Sophia and I will ask people
Mm-hmm.
similar questions like, do you have a faith practice or a practice that you incorporate?
Do you pray?
So I knew that this gal was Christian, and I said to her, I think sometimes we're very quick to just like leave the other things that seem very anti-Christian, like meditation, breathing that has sound to
acupuncture,
it, yoga, because it feels very like, woo woo, or all of a sudden now I'm, this practice was started by people that don't believe in God. And so it's probably demonic or some just wild, extreme version of. But I said to,
well, you were watching Netflix earlier. What's the spiritual practice of the people who founded that streaming platform?
Okay. But in the context of spiritual things, I said, tell me about your bedtime routine. And, I think a lot of people in the last few years are being hip to get the blue lights off, do this, do that. I'm going to snuggle my puppy. I'm going to get some happy hormones going on. But something she said was, I kind of struggle in those last few moments of going to sleep and like, what is it am I doing with my brain in those moments or the moments before I turn off the light? And I said, this is a great opportunity to light a candle. Flames are incredibly grounding and regulating for your nervous system. Just a small little candle next to your bed or in your living room before you leave kind of the communal area of your home. And then spend a minute with your hand on your heart and your hand on your womb. And I want you to take deep breaths and tell your body how thankful you are for what it does do well. And tell your body how you believe that it can do things better and that you're on its side. And since I know that you're Christian, invite God into that conversation. Tell God that you're thankful for the body that He's made and that He's there with you, that He can see your ovary and that it's not ovulating yet, and that He has answers for that. And as much as anybody listening to this, if that is offensive to you, spend time with your body, touching the parts of your body that need extra love and care. You may be doing it in the kitchen. You may be doing it in the gym floor. You may be doing it at the counter where you're sorting your supplements. But are you doing it with hands that are telling your body, you're safe? There's rhythm. There's rhythm to your breathing. There's rhythm to your heart beating. There's rhythm to that flickering candle. And can you build a practice around saying to your body, you're safe and you're loved and you're not alone?
Yeah, that's so beautiful. I think that's a beautiful practice to recommend. And just one other thing that I would say that is more physiologic than spiritual, which is when we feel unsafe, we're in that sympathetic nervous system overdrive that's sometimes called fight or flight, flee, freeze, fawn. We have a lot of different words for that activated sympathetic nervous system. But from an evolutionary biology perspective, our body would then perceive, I'm in survival mode. And when you're in survival mode, it's the wrong time to conceive. You're just trying to survive. You need to feel safe to be able to conceive, which is then this reproductive, ability to create new life. And so I think that practice is a beautiful spiritual practice. It's also a beautiful practice for quieting the nervous system and putting you into that parasympathetic nervous state, which is about safety and is about now is the time that I can create new life.
Mm-hmm. That's beautiful. I think that's a great place for us to say, yeah, girl. Let's switch.
Yeah, girl.
Let's switch the mode of the convo.
Hey, it's me again, Sophia Pavia, registered dietitian nutritionist specializing in women's health, fertility, and optimal progesterone production. And I'm interrupting an episode of my own podcast to tell you about my online course called Ovulation Unlocked. So if you've been listening to our podcast episodes, you've probably heard a lot of things about basal body temperature, cervical mucus, cervical position, and tracking your fertility. Well, I have designed a 90-minute self-paced online course, which I titled Ovulation Unlocked, that puts all of that together and teaches you how to be the expert on your own fertility from home. This course is designed to put you in the driver's seat of your own fertility, not only so you can know what's going on with your body on any given day, but so that if you need medical help, you can show up to the appointment informed and ready to communicate. Too frequently, us women show up to our doctor's appointments and just say something like, I want to have a baby. And the doctor looks at you and says, good for you. Stop using birth control, start taking a prenatal, come back in a year if you're not pregnant. And that's all we get. However, Ovulation Unlocked puts you in the driver's seat, puts you in control of your fertility to where if you need help, you can show up to that appointment informed and ready to communicate your needs. So if you want to become the expert on your own body and your own fertility, head on over to my Instagram bio and tap the Ovulation Unlocked link today.
Dr. Victoria will give you a taste of what yeah girls feel like. So I'll start with my yeah girl. I was thinking about it earlier this episode when we were talking about microbiomes. And at the end of this appointment with my client earlier, my son ran in and he sat on my lap. And I also know this client a little personally. And so we were just talking for a little bit after the episode, and I started kissing him on the back of his neck. Growing up, my grandma used to call that the sugar bowl. And so my mom used to call it the sugar bowl. It's like where you go for sweetness and kisses. And I was just kissing him. And this individual and I had just been talking about the microbiome of sourdough in the hands of sourdough makers. And I was like, you know what? I bet if we swabbed Seamus, my son's, the back of his neck, his microbiome and my oral microbiome would probably be like mirrored bits of each other. And so my yeah girl is just the joy of having come full circle from the 18-year-old that got told she probably wouldn't have a baby to like holding my youngest baby who's 4, kissing on that sugar bowl.
How awesome.
That's my yeah girl.
Yeah. For as
Seriously.
long as they'll let you. Well, yeah, girl. That is a huge accomplishment. Becoming pregnant 3 times, 3 healthy kids born with PCOS. That is a yeah girl
girls.
from heaven. Yeah, girl. Yeah, and may the listener be so encouraged that this
Seamus's
can work
neck
for you.
microbiome.
Okay, my yeah girl, I gave you guys a hint of it before, but I am wearing jeans that fit my belly and are not an awkward high water
Way to go, girl.
People that manufacture garments have decided that no one is allowed to be over 5'2", and if you have long legs, just wear shorts, girlfriend. We're not making jeans for you in the maternity world. You can't be pregnant and tall at the same time. Who do you think you are? That's what I felt from the maternity jeans industry. But I found a pair that fits me. And so I feel really happy about that because jeans are such a staple in a winter wardrobe. And I'll say one other thing. Okay. Earlier in this episode, Dr. Victoria was saying something so poignant. And meanwhile, over here, this wee babe I have in my womb was like rave dancing. It felt like this swirling of hands. And it was so funny and so distracting. And I feel a big yeah girl that I'm feeling my baby move so much. And that I can tell that my baby is head down and already facing the left side because this is the left side is where I'm feeling so much kicking on top and swirling wiggles on the bottom. I call it Mr. Burns hands. This is what it feels like. The baby's going, wiggling
Simpsons
fingers.
reference.
And so that was a Simpsons reference. If you watch this at about 30-minute mark, I sort of start kind of getting weird in my seat here. And it's because this baby is like really going wild. And so that's really exciting that I'm finally at that place in pregnancy. I'm 19 weeks where I can feel this baby swishing and swirling.
Love it.
He or she has settled down now. Not
That's
much
wonderful.
movement now, but
Yeah.
it was
And
wild a few minutes
he or
ago.
she shall be doing somersaults in that belly for a while.
Yeah, yes, turning every which way, but I more just feel not happy that the baby's in a specific position at 19 weeks. Like that's going to change all the time, but I more feel proud of myself that I know what it
Yeah.
feels like when a baby is in one position or
Love
another.
that. Yeah, girl.
Mm.
All right, Dr.
Yeah.
Victoria. It could be something wild and crazy. Could be something you're excited about. What can we say, yeah, girl, to you?
Well, I'd
about?
love to do a twofer as well.
Yeah, go for it.
Go
The
for it.
first I'll say on the personal is that when my youngest, I have three, I now say adults rather than three children, but when my youngest went off to college, I started dancing and taking evening dance classes. And this weekend, I have 3 different dance classes that I'm going to. And I'm so happy that that's part of my life because it brings me a lot of joy. It gets me completely out of my head. If you've listened to this point, you probably have a sense that I spend a lot of time in my head learning and,
Yeah, very
So
cerebral
I'm
person.
really looking forward to those dance classes. Well,
What kind of dance is
most
it?
recently I have been doing a kind of Cuban salsa dance, which is done in a group
fun.
outdoors at the university. So it's a club, and yes, it's similar
Is that
to
like
casino. Yes,
where you're like
exactly.
moving
Yes.
from person to person?
Yeah. So it's
Okay.
very fun. Correct.
And you have like somebody like
That's
calling
exactly
out what
right.
you're supposed to
Yeah.
do next and all
Yeah.
that. Oh, I love that. I used
Yeah.
to do that in my early
And
college.
I
It's
find it
such a
very
fun dance.
and you have to be in your body because if you're in your head, you mess up. And so it's a really great practice that gets me completely out of my head. But on the head side, the professional side, I'm just going to say I'm very excited about Heal Faster because it is my way of putting out in the world stuff I've spent decades learning. And I hope that it'll really help make a lot of people healthier and give them tools that are not necessarily widely known and widely available. So thank you for having me on and letting me share a little bit of Heal Faster.
Oh, our pleasure. Absolutely. You've been a wonderful guest. And I just Googled your Barbra Streisand roast, by the way. And so it's sort of like the quintessential when you buy a clothing item that is that dusty rose, you know what I'm talking about, that pinkish color, that is the color of the Barbra Streisand rose. I didn't look up the entomology, not that either, but you know the why it's called that. But I did look it up, and it is a gorgeous rose. Congratulations! Did you grow this rose yourself?
I think the nature and helps the rose grow.
No, but like, was this like your neighbor's rose plant you walk past, or was this like the plant that you tend?
To the huge outlet that had about 100 different kinds of roses that you could pick from, and I picked Barbra Streisand, and so yeah.
That one just looked like it was the light of love to you, huh? You could see it on a clear day. These are all Barbra Streisand song references if you don't know. Not a lot of Barbra Streisand fans, maybe a little before everybody's time, but I love Barbara.
Well, this has been delightful.
Thank you so much for coming on.
We're so happy to have you. I'm going to definitely.
Yeah, girl. We didn't ask your people to send us your book. We almost always do that. So we got to do that. Get your folks to send us your book.
I was going to say, I want this on my shelf.
We do want to read it. I want to learn how to heal faster. Yeah. Holy crap. Yeah. I'm about to have a baby, have a postpartum time, heal that up fast as possible.
And do you think for those that end up with like a cesarean that this would be a great book for healing faster in a postpartum period? Maybe not whole specifically for that, but
on surgery, both preparing. So especially for people who know they need to have a cesarean, if it's a scheduled cesarean, an elective cesarean rather than an emergency cesarean. There are many things you can do to prepare And then there are a bunch of things you could do to recover more easily. Nothing harder than recovering with a newborn, right? And they tell you don't carry anything that weighs more than 10 pounds and your baby weighs 12 pounds. I find that interesting.
Yeah.
All kinds of contradicting. Sleep when the baby sleeps. So the baby's only going to sleep when the baby's on you, but don't sleep if the baby's on you.
Yeah. Well, I hope you have a beautiful birth and a healthy baby. Yes.
Lord, may it be. Yeah. This is my prayer as well, that I have to continually remind myself that God is doing something new, that this is a new thing, that this isn't going to be the birth experience that I've had with my others. This is something new. And so thank you. I will receive that in the Lord. May it be unto
All right.
me.
Well, listeners, you heard it here. Heal faster, unlock your body's rapid recovery reflex with Dr. Victoria Maizes. Check out her work. Check out her other book, Fruitful. I want to look at that one too. We've enjoyed having you. We will have links to these things in the show notes, so you can check that out, listener. Leave a review, rate, share this episode with a friend, and we will see you next week.